Let's now move on to our regular segment for Mondays, where we turn to a medical expert for a more in-depth diagnosis on the current issues surrounding COVID-19. For this, we have Dr. Alice Tan, internist at MizMedi Women's Hospital via Skype. Dr. Tan, thank you again for joining us.
Thank you for having me.
Well, the number of new daily infections in South Korea has been lingering around the 2,000 mark for the past week, and the nation has observed the highest social distancing level in the capital area for quite some time now. Why do you think aren't we seeing the numbers go down? How long do you expect the situation to continue?
I think the current situation is that of a stabilization or a plateauing of the transmissions right now. And we're seeing a decoupling effect of our vaccination campaign. In other words, even though the number of cases remains high, the number of cases in ICUs has slowly been going down, and this is certainly good news. Even though the capital region, as you said, is at its highest level, level 4, which is essentially a shelter-at-home situation, the fact is many businesses, most all businesses, are still open. The only businesses that are not allowed to operate are nightlife venues, certain card gambling sites, and discos. But everything else is open, and I think that's just showing that the transmission is ongoing, but because of vaccination and the mitigation level measures that are taken among seniors and those at high risk, that's why the death rate has not gone up considerably, considering the high level of transmission.
Well, Dr. Tan, lately I've noticed the frequency of the phrase living with COVID being used more instead of the term herd immunity. And I also remember when many were talking about not having to wear masks after getting vaccinated. And, once herd immunity is reached, we would be able to return to normal. But we're no longer hearing this anymore as much. What is the reason behind this? Will we ever be able to remove our masks?
I think it was the emergence and spread of the Delta variant that really changed the whole scenario. And certainly the goalpost, so to speak, of what level of population immunity we needed in order for mitigation levels to be downgraded, that has changed. If you consider that even if South Korea were to achieve 80% full vaccination, that would leave 20% of the population vulnerable. That's 1 million people, and that's still a lot of people who could get infected, and then that certainly could lead to an overwhelming of the hospital system. And so I think that's why we have a new outlook on the forecast for COVID-19. It's more one of living with the disease. And then certainly when we learned about the high transmission rates of breakthrough cases, that also has caused people to be more wary about lifting any sort of mask mandates. And of course, there's so much crowding in this very high population dense region, which is the Seoul metropolitan area and many urban centers in Korea. I think it's going to be very many months before people can take their masks off.
Well, like you've just mentioned, that is probably why many countries are now turning to living with corona. But looking at the UK, for example, which has adopted a more relaxed policy where mask wearing nor social distancing is no longer controlled, the country's daily new infections have rose evidently to an average of 37,000 a day for the past week. And with concerns rising, what do you think is the reason behind this? And what should we do to avoid some similar situation?
Well, certainly it's the Delta variant that's raging through the country, but because they have a high vaccination rate, they're not seeing explosive levels of hospitalization and death. Still, it really depends on your perspective. They have a 7-day average of deaths above 100. That's daily deaths above 100, and from a Korean's perspective, that may seem unacceptable. Also, the number of patients in their ICUs is also above 1,000. From a Korean perspective, that's also very, very high. What Korea needs to do is make sure that they achieve a very high level of full immunity before measures are eased. And I think given the high population density and the crowding in indoor areas, I think people should keep indoor mask mandates for a prolonged period of time, at least a few more months before we can say masks off indoors.
Mm-hmm. Now, shifting to other stories, last week we've heard some interesting news about global pharmaceutical companies' development of oral COVID-19 treatments. But this sparked controversy as it was reported that these treatments could cost nearly around $800. How far has the development of these oral treatments gone, and why are they so expensive?
Well, this is certainly good news on the horizon. There are 3 pharmaceutical companies, Adamas, Pfizer, and Merck, that are testing their oral antiviral COVID-19 medications in phase 2-3 or phase 3 trials right now. Hopefully, we will see positive results by the end of the year. The reason why new medications are expensive is because it just takes a lot of money to develop these medications. A lot of R&D goes in, and these were not vaccines that were part of Operation Warp Speed, and so pharmaceutical companies are having to charge high prices for new medications. But if you consider, if these medications can prevent even one day in an ICU, it would be very much worth it to pay even $800 for one pill, because the can be thousands and thousands of dollars. So unfortunately, that is the reality of new medications. Hopefully, we will see antiviral medications roll out either before the end of the year or in early 2022.
Thank you, Dr. Tan. We apologize again for the sudden technical malfunction. All right, we will have to wrap up our discussion for this week. This was Dr. Alice Tan of MizMedi Women's Hospital. Thank you again so much for your wonderful insights, and we again apologize for the technical inconvenience.